case. Here's a very nice case that was loaned to me by Dr. Bash. You can see the patient was originally seen in 2009. You might suspect that this was an Alzheimer's disease. Does look like there's asymmetric temporal lobe volume loss. It was clinically suspected, so the patient had an FDG metabolic PET. And you'll see in this metabolic PET, fused to the CT here, fused to a subsequent MR here, that there's pretty clear, distinct hypometabolism in the temporal lobes. This patient came back in 2016. You can see that the atrophy has clearly progressed, where your first-year residents might be able to say that this is clearly a temporal lobe volume loss Alzheimer's disease case. But in this case, the patient had volumetrics done. And you can see in this case, there's clearly hippocampal and temporal, in this case, even frontal lobe volume loss at this point, pointing to Alzheimer's disease. The patient had a subsequent amyloid PET. Is this positive or negative? Does it mark the white matter or go all the way out to the edge of the brain? This goes all the way out to the edge of the brain. This is a clearly positive case. Now, MRI has an important role in these therapies. You can't get on the therapy, you can't initiate therapy unless you have a recent MRI. And this recent MRI is there to screen for conditions that increase the risk of hemorrhage. As you'll hear in a moment, these amyloid targeting therapies lead to inflammation of the blood vessels, and of course hemorrhage would be a natural accompaniment to inflammation. So we look basically for prior bleeding, how much stroke, if there are any vascular lesions. The longer list looks like this. And obviously this is an example of amyloid angiopathy here with lots of little chronic hemorrhages in the brain. Siderosis on the pre-screening exam would suggest there'd been significant prior bleeds. More than 4 microbleeds would keep you, would exclude you from the therapy. And again, anything that points to the proclivity of hemorrhage would, including lots of old infarctions, softer indication, would essentially lead to exclusion from these new drugs.